All right, we'll get started with today's live class. In this one, we're going to be looking at OET Listening Part B. I'm going to show you not so much a method for Listening Part B, because as I'll show you, the method, you need a method for each question type. And there are lots of different question types in Listening Part B. So I'm going to show you those different question types today, and we're going to think about how the transcript connects to those question types. So on test day, when you see your test paper in front of you, there's no confusion or ambiguity. You'll know exactly what to do as soon as that audio starts to play. So let's have a look at this. This is OET Listening Part B. It's a method. So in this live class, I'm going to firstly give you an overview of this part of the test. We're going to look at the different question types, and there are, I didn't count, but I think there are about 15 different question types you might see on test day. And then lastly, we're going to look at an example transcript for this one. So firstly, let's just do a quick overview of this task. So it's going to be a monologue. In other words, one speaker. It's going to be a lecture. That lecture is going to be on a general health-related topic, so it won't require any specialist knowledge. It'll be something like, I don't know, the speaker might talk about diet or, sunburn or, something that's medical based, but again, you don't need to be a dermatologist to understand what's going on. This will apply to all professions, including vets, nurses, dentists, you name it, okay? Interestingly, in this part of the test, you'll write your answers directly onto, or into rather, the test booklet. So not onto a separate sheet of paper, you'll write them directly into the booklet, because as we'll see when I show you the question types, there are flow charts, there are table completion, there's all these question types. So you write it directly into that booklet there. Also, in this part of the test, you're allowed to misspell words. Spelling is not super important as long as the examiner can read your word and know what it is. So as long as your spelling isn't too bad. And this part of the test is worth 50% of your listening grade. So it's just as important as listening part A. Now let's have a look at the different question types you might see on test day. This is worth knowing. The first few that I will show you are called the completion questions, and there are a number of different completion questions. So first of all, there's list completion. You might see something like this on test day. It says, complete the following lists. Symptoms of patients with heart problems include, and you can see chest pain, you can see 2 blanks, you can see syncope and another blank. So you'll probably be writing down, well, you're going to be writing down symptoms as the speaker says it, and you'll be writing them into here. Now, I've just recently taken the IELTS test for the second time, just because it's a great experience for an English language teacher to do that. And what I found in IELTS listening, which is quite similar, not dissimilar to OET Listening Part B, is, well, first of all, I found it hard because you're trying to make a connection between that test paper and what you're hearing, okay? One of the things that I did on test day that really helped me, and I suggest you do this on test day as well, is I did in fact underline words to remind myself what I was listening for. I underlined key words like symptoms, for example. And then when the audio was playing, blah, 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 I could pick out the little symptoms from the audio and type them in or write them onto the test paper. But underlining that keyword was truly important. Okay, there's note completion. You might see something like this, which is very similar to the one we just saw. But the one we just saw, this one looked at symptoms that include, this one is history of pain should include, blah, 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 blah. Very similar. Summary completion. Okay, this one is quite different. What this question is a summary of what the person is saying. It's basically another way of saying what the speaker says. Okay, let me explain this. So the lecturer is speaking and saying one thing, and written on the page in front of you is his words written differently, but saying the same thing. So you're sort of, he'll be talking a lot, or she'll be talking a lot, and this is a summary, and it'll summarize. Say he says 3 sentences, this will have 1 sentence, and there'll be a key word missing or a key couple of words missing, and you have to just complete the gaps. It's a bit tricky, but it makes sense on test day. Flowchart completion. Okay, this one, a similar sort of thing. So the speaker's going to be describing, in this case, the exercise nuclear scan, and say something about the patient is blah, 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 and you fill in the gaps as you listen. It's quite similar to the one before, except it just looks a little bit strange. Information completion. Again, very similar sort of thing. Complete the following information cards on cardiac monitors. Table completion, you'll have to listen and also fill in one of these. Now, what you'll need to do on test day with this is just make sure you're filling in the right one. So we're talking about CT scan here. Here are the advantages of the CT scan. Here are the disadvantages of the CT scan. MRI, here are the advantages of the MRI and the disadvantages of the MRI. Okay, and it will be very clear from the audio where you're up to. The speaker will give you signposts and say, okay, now with regards to the MRI, there are several advantages. For example, blah, blah, blah. So you'll know which box in that table that you're filling in. It won't be too difficult to follow that, but you will need to listen carefully. You'll need to possibly do a diagram completion, which will look like this. One thing I should mention is, I'm going through these very quickly. On test day in listening part B, you're given time before each question to look at that question and wrap your head around it, to understand what you're looking at, okay? I don't know how much time it is. I've forgotten. I think it's like 20 seconds, something like that, to look at that diagram, read the instruction, and prepare yourself to listen and then fill it in. So you do have time, but it's good to familiarize yourself with all of these question types. So on test day, it's not completely new. You might see something a little bit different to this, but this is what the diagram completion looks like. There's also sentence completion. You can see here we have the first half of the sentence. For example, this one says, structural congenital heart disease used to be. It doesn't tell me how many words. It just says complete the sentences. Terminology was confusing because some conditions, now people use 3. So you'll be just filling in a word or 2 there, I imagine. Gap fill, this is similar to completion. So the speaker works with the Newborn Emergency Transport Service in Victoria. The speaker plans to talk about the incidence of CHD in Australian newborns. So basically completing the sentences that the speaker says. You might also see direct questions. What is the speaker's profession? There's a direct question, cardiologist. What is the speaker planning to cover in the talk? Cardiac investigations. Which test is right for which patient? A couple of things to mention here. Now, these test papers are actually marked by humans, examiners. And so there may be a variety of different ways to answer this. For example, this one will be cardiologist. Or you possibly could write, he's a cardiologist. That would also be correct, but you don't need to. You just need to write the single word there. Which test is right for which patient? There are probably various ways to write this, and that would also be correct as long as you get the main idea in there. Now, this brings me back to what I said before about underlining. In that 20 seconds you get before you hear the audio for this particular part, I would underline speaker's profession, and I would read this. What is the speaker planning to cover in the talk? So then when I'm listening, speaker's profession, speaker's profession, speaker's profession, I'm listening, and he says, oh, by the way, I'm a cardiologist. Boom, you write that word into there, okay? plan to cover in the talk, or what's he going to talk about? What's he going to talk about? And then he says, in this talk, we'll talk about cardiac investigations, blah, 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 and which test is right for which patient. So keep that in your mind. Answer question. This is a little different. It says, answer the following question. What are the objectives of the speaker's lecture on congenital heart disease? Again, the key word here would be objectives. What are the objectives? So he's going to review something, he's going to review something else, and he's just going to describe something. They're the objectives. And I would personally underline that word before the audio starts. Short answer questions. How does the speaker define an echocardiogram? What does the speaker believe an echocardiogram gives a very good idea about, etc.? Multiple choice questions. Well, this one's pretty simple, but have a look closely at here. It says functional tests assess the effect of, then we have our gap. Exertion on the heart, trauma on the heart, or drugs on the heart. During an exercise ECG, ischemia will be signaled by a drop in blood pressure, heart rate, or ST waves. So you got to fill the gap either in the middle or at the end of the sentence. And it might be different on test day. So please read them carefully. Check the answer. This one's kind of interesting. It says, check 3 maternal risk factors the speaker mentions. So you will have to listen very carefully and you go, okay, he mentioned multiple births, he mentioned diabetes, and then he mentioned diet. Now it says here 3, and you will get 0 marks if you tick more than 3. So make sure you, make sure you read this part carefully. They, my friends, are the different question types that you may see on test day. Of course, you won't get all of them. I think in the one I just looked at, there were about 6 or 8 different question types, but you should be prepared for them all. I think there's possibly even more than that. So on test day, make sure you use that 20 seconds before the audio plays to look at the question, read the instruction, and know what to do before that audio starts playing. That's really critical. Let's now have a quick look at and listen to the transcript of what the lecture will sound like. It's a very real lecture. It's not scripted or it's semi-scripted, so it actually sounds real. It has the hesitations, the ums and ahs, and also different to the IELTS. The IELTS is a script that somebody's reading, and so it's very clear, but this is different. This is real English, you could say, when it sounds a little bit messy. So it might sound something like this. My name's Dr. Neil Strathmore, and I'm a cardiologist. And today I'm going to talk about cardiac investigations and try and tell you which test is right for which patient. Okay, so you can see before, and if you remember correctly from that first question we saw, or the question we saw before, I'm a cardiologist. And the second question was, what was the purpose of this lecture? Today I'm going to talk about cardiac investigations and try to tell you which test is right for which patient. Now you can write that verbatim, word for word, or you can write another way, that would be fine. But you can see that the answers to the questions are going to be hidden in amongst the other words. That's what you're listening for. Let's have a little look at this one. Patients who present with heart problems present with a variety of symptoms, such as chest pain, shortness of breath, palpitations, syncope, and edema. In addition, patients come along because a problem has been picked up by another doctor, such as high blood pressure, a heart murmur, an abnormal lipid profile, or patients present for assessment of cardiac risk to see whether they're likely to have a heart attack. Now again, within this, if you remember before from that question I showed you, it said, what are the symptoms? So here's the key word which indicates you're going to hear a bunch of symptoms. This one was listed. I think this one was listed. This one was not listed, so you would have to write palpitations. Good thing is that you don't have to worry too much about spelling. Syncope was listed, and the last one I believe was edema. Let's read further. It says, in addition, patients come along because a problem has been picked up by another doctor, such as, and this probably was the second question, high blood pressure, a heart murmur, an abnormal lipid profile, and you might have to write down one of these. Anyway, that's about all for listening part B. Listening part B is different from the writing and actually different from reading part A and listening part A. Doesn't really require a method per se. It just requires familiarization with the question types and practice. I think that's probably the best thing there. Yes, that's all from me. I'll now go to Q&A. If you have any questions, feel free to type them into the chat. I'll hang around for about 10 minutes and answer some questions if you have them. So let's do that. We have a question here from Prachi. In speaking, do they check your body language? No. Nope. They're purely listening to your voice. And I don't have my phone here, but the person you're speaking to on test day is not the examiner. It's not like the IELTS. In the IELTS, you're speaking to the examiner. In the OET, you're speaking to an actor. And what's happening is your conversation is being recorded and it will be listened to later by an OET examiner. So they can't see you. They're just listening to your voice. So if you're trembling or shaking, or if you're just looking at your task card, that's fine. The role play card rather, that's fine. So you don't need to worry about how you look or how you present yourself. You just need to worry about listening and speaking. That's all. Julie, are the tense of the words important, especially for filling gaps? I'm going to say yes. I'm going to say yes. Spelling doesn't matter that much. But let's say the question was, okay, I'll just make a really simple example. And let's say you have to fill in a gap with a verb. And it says, George, gap, heart attack. Okay, now think about the difference between George had a heart attack. So George, gap, a heart attack. George had a heart attack. George is having a heart attack. George will have a heart attack. George has had a heart attack, has been having heart attacks. So yes, the verb tense will be important to get right because it says so much information in that verb tense. What if the answer is acute pain and I write only pain? Great question. The answer is you should include the surrounding information. For example, you should write acute pain, not just pain, because they're looking for a specific answer. In the IELTS, for example, I remember this question I had, it was in the reading, but it's a similar thing. It said something about what fabric is produced in the home. And the answer was sheep's wool. Sheep's wool, not just wool, because that could be llama's wool or goat's wool or cashmere wool. It was specifically sheep's wool. So the answer was actually sheep apostrophe S wool. And I imagine the OET do something similar here. So listen, if you have to write a word like pain, and there's an adjective there like acute pain or chronic pain, make sure you include that information too. Pallavi, does listening improve by watching movies? I think for listening part B in the OET, you're better off to listen to medical podcasts, not watch movies, because you're going to be, or medical lectures, okay? Because it's quite a different style of listening. In a movie, you can see their face. You can see their mouth moving. In fact, it's a lot easier. In listening part B and listening part A, you're just hearing. You're not looking at anybody's face. Plus, the topic is medical. So I suggest listening to medical podcasts. Alido, please, is it possible for you to touch on reading part B before the next exam on the 4th of November? Probably not, but we do have the OET Reading Part B method on e2language.com, as well as practice if you want to go there. Zenarth, how is the calculation of marks done and scores are given in listening subtest? Okay, so for listening part B, it's just whether you got the answer right or wrong. It's pretty straightforward. There's going to be one word that you need to put in the gap, or there's going to be one multiple choice that you need to circle, or the flow chart will have this part that you need to fill in correctly. That's pretty straightforward. Listening part A is a little bit different because you're note-taking. You're listening to a conversation between a medical professional and a patient, usually, and you're taking down key ideas, key facts related to the topic of that section. So it might say frequency of headaches, for example, and you need to write down twice a week, lasts for 3 hours a day, whatever it is. So you're listening for facts. So they mark that by how many of the key facts you get right. Yes. In the writing test, is a comma required after Dear Mr. John Smith? Yes, I would say yes. That looks better. Julie, are there cases where the words had to be changed before filling the gaps, or is it usually the same words that the speaker is talking? Okay, great question, Julie. Okay, let's go back to that example about George gap heart attack. And it says complete the gap. And the answer is George has had heart attack. Is that grammatically correct? George has had heart attack? No. We need a word there, and the word is a. George has had a heart attack. Whenever you fill in a gap fill, for example, it needs to be grammatically correct. So make sure if you need an article, put the article in. If you need a preposition, put the preposition in, because it will only be correct if it's grammatically correct. Okay, good question. Ioida Gonzalez, in writing, the maximum word count is up to 200. What if we exceed the number of words? The OET are not strict with writing word counts. You can write between 180 and 200 words. That includes the body of the letter, right from where you say, Dear Dr. Smith, down to yours sincerely. So the address is not counted and the date is not counted in the word count. In fact, Dear Dr. Smith may not be counted. Dear Dr. Smith, 3 words may not be counted. It's just the body of the letter. The 180 to 200 words is an indication of how many words you should write based on the relevant case notes. If you write 220 words or 250 words, you're probably including irrelevant case notes according to the task. Okay, so it's just an indication. If you write between 180 and 200, you're probably writing relevant information, which is good. Don't write irrelevant information. You need to disregard, leave out, forget some case notes. That's important. Hi Jay, I have a question pertaining to reading part A. If you missed an article, or the in the answer, will it be considered wrong? Yes. So same thing with listening part B and reading part A. You need to make sure, reading part A, you definitely need to make sure that that verb tense fits. Is it a singular or a plural noun? Is it X-ray or X-rays? Because then the next word will tell you what the noun should be, for example. So yes, you need to make it fit. And if you miss an article or miss a preposition or miss the S on the end of the noun, it will be considered wrong. So you need to get the word form, the grammar right in reading part A. And in fact, that's how they trick you. Because in the text in reading part A, it might have the word like symptom, for example, but then in the gap, you need to write symptoms with the S. And if you just take the word and put it in without transforming it to fit the grammar, it will be considered wrong. So make sure you transform correctly. If I practice more IELTS materials, can I improve my OET results? Because it is difficult to find enough practice materials. Great question. And I think you're right. Even though IELTS is non-medical based, I think just practicing IELTS tests, especially listening, reading, yeah, I think it'll be helpful. The OET Listening Part B and IELTS listening are very similar. Listening Part A, not so similar. Reading, OET Reading Part B, yeah, I think doing IELTS will be helpful. IELTS practice will be helpful. And yes, you're right. One of the problems with the OET is it's very difficult to make practice materials. You also need to be very careful about where you get your practice materials from, because there are a lot of websites out there that create very poor OET materials. The OET have just launched a new accreditation system called the PPP, Premium Preparation Providers. So if you go to their website and you click on the PPP, you can see all the good schools around the world that have been accredited. They've been listed because the content that they create is very high quality. E2 Language is on that list for PPP providers, by the way. Don't use a website that's not PPP or a school that's not PPP. How many questions has to be correct to score grade B in OET? I don't know the answer to that specifically, but I can tell you this. I have had candidates who have gotten a B and not completed all of reading part A. So I don't know about that. You don't need to get 100%, or, you know, you can miss some questions. That's fine. Julie, I was thinking of going for the budget pack. How many practice tests does it provide? Currently, it provides 3 full practice tests. So 3 writing subtests, 3 reading part A, 3 reading part B, 3 listening part A, 3 listening part B. We're currently adding more content. So within the next 2 weeks, we're going to have another 3 writing, 3 reading, 2 or 3 reading. So just stay tuned for that. In the meantime, yes, I think it's very good practice. Plus you get all of these methods lessons as well. And if you're interested in upgrading to a higher package, you get the one-on-one tutorials, which are extremely helpful for writing and speaking, and even reading if you're really struggling with reading, just to get the method right. But certainly for writing and speaking, our tutorials are really good. Basically what you do for writing is you submit your letter, then you meet with the teacher online using a program called Zoom, which is like Skype, and the teacher goes through your letter with you and corrects it for you and looks at things like task achievement, whether you wrote the letter to the case notes, relevance, did you select relevant case notes, organization, did you organize your letter logically, transformation, did you transform your case notes into grammatical sentences. So we look at what the OET examiners look at and tell you how to write a good, strong letter. And speaking, you do speaking practice and get feedback on your speaking. It's a good thing to do. Is it right to put date of birth and address of the patient beside read patient name? Have a look at the sample letters on the OET website if you're interested in how to format your letter. How can one locate the reading part B method on the OET language website? It should be there. If you need help, Alito, please email hello@e2language.com. What about abbreviations? Can we use in listening part B? Abbreviations in listening part B. I don't know. I don't know. Just let me find out for you. Let me find out in 10 seconds because I have the website open. The answer is yes. For example, blood pressure, you can write BP. The only thing is you need to write just common abbreviations, Okay, so common medical abbreviations will be fine in both listening part A and listening part B. Don't do any technical, really abstract abbreviations. Jay, do you take speaking mock tests online? Yes, we do. We do it on Zoom, one-on-one with the teacher for 40 minutes. You get to run through 2 role plays and get feedback on both role plays. It's good, it's good, it's good. Ashish, what if spelling is wrong in our answers? Well, for listening, it doesn't matter. For reading, it does matter. Jay, I'm a paid member. Do I need to book study plan before I go to all the videos? I think it's a good idea to take your study plan consultation. By the way, if you're interested, you buy a package with a study plan consultation. It's a one-on-one with the teacher. It's the first thing you do. We basically talk you through the course. We look at your previous results, the results that you need, how much time you have. We set you up with a study plan, and we answer any of your questions you may have. 10 hours face-to-face in a school will consider necessary before you apply to OET? Not necessarily. If your English is low, you should probably consider doing an academic English course. If your English is pretty good and you just need test practice, then E2 Language is the place for you. Marianne, hi Jay, what if I'm writing a referral letter to a home care nurse? Should I start it like this? I'm writing to refer Mrs. Bank who needs further nursing management care at home. Thanks. Yes, that sounds good. That introductory sentence is important in your writing. You should say, the reason why you're writing, I'm writing to refer, discharge, transfer, whatever it is. And that main reason why in terms of the medical situation, I'm writing to refer Mrs. Smith into your care who requires physiotherapy for her leg. Something like that. So that introductory sentence should be very clear and outline immediately to the reader of the letter why you're writing. Don't bury the important information. Make sure the important information is right at the top. Here's a question about I won't answer the writing ones. You can watch the writing webinar up here, or if you're a paid member, it's in the website. If I get into the budget pack for now, which is valid for 6 months, will I avail the extra test material which you have mentioned, or should I just wait for the offer? Yes, if you sign up now, we'll just update the website with new material and you'll get access to the new material, so that's fine. I'm guessing that the new material will be, the writing should go up in about 10 days to 2 weeks. Reading, I think everything should be up in a month, more material. So if you are taking your test in 3 months' time, you can sign up now. You'll just see the website get populated with new material. Julie, are the practice material that you provide on your website the same one as the OET website provides in their packages? No, we write our own material, so it's different to what you'll see on the OET website, okay? Hi Jay, can we have a webinar on or anything to check our writing? I'm practicing but not getting it right or wrong. You need to get feedback on your writing. You need to have a tutorial on your writing to find out what you're doing right and what you're doing wrong, okay? I can't really do it through a webinar because I need to see your writing, but if you do a tutorial through E2 Language, you can get that feedback immediately. The OET test is expensive. You only want to do it once. You want to get it right. I'd say prepare properly for this test. It's harder than you think, especially reading, and writing can be difficult if you don't know what to do. Listening doesn't seem to be too bad, and speaking doesn't seem to be too bad, but writing and reading are incredibly tough. Cool, I'm gonna leave it there. If you're on YouTube, by the way, please click like and leave a comment. I'm sorry I didn't get to your questions, but you can join the live class next time and you can meet me here. Cool. I think that's all. Thanks very much for coming along. I hope it was helpful. My name is Jay. I'll see you guys soon.